Back home now, Newzroom Afrika understands that there have been 50 confirmed COVID-19 positive cases among the crowds gathered at the Beitbridge border post. Let's take you live now to our reporter, Pelane Pakgadi, who joins us there live. In fact, he's been there for the last few days. Pelane, that figure, including people who had gathered there yesterday, you and I have been talking over the past few days about the congestion at the border. The Home Affairs Minister in South Africa, Pelane Pakgadi, also himself saying that a humanitarian crisis is brewing there.
Well, one is brewing, and I can tell you now, when we were just trying to kind of fish around to understand the extent of work that still needs to be done, and how the people in the officials in the Beitbridge border post Zimbabwe are still expected to make work and ensure that people are coming into South Africa in drips and pieces, in drips and groups, of course. And what we have found out as Newzroom Afrika is that there was about a minimum of 50 confirmed cases of COVID that tested positive when they are testing here at the Beitbridge border post. Those people have been turned away. But I think the main concern, not only for South Africans, but for you and I as well, is that those people were gathered in large groups yesterday before they were dispersed and turned away and turned back into Zimbabwe yesterday, and some others processed in, and gained entry into South Africa. So the challenge now begins that in that particular congestion where scores were gathering and waiting to be processed, there were positive cases, and we do know that this virus spread quite easily, it's quite contagious, and while there was scorching heat and so on, there were people really struggling to put their masks on, and then there was that issue around the social distancing that was not adhered to. So that was the challenge, and the major challenge that we've seen yesterday, Michelle, and it's just, you can see, well, a little bit of your distancing here today. There is not as much congestion as it was yesterday. People literally coming through in their groups as have been expected and put together by the officials here. I don't know, perhaps if you can just allow me just one more minute, Michelle, just to get some reactions. 4 days other people have been standing here, and perhaps even to ask about that particular question. So how are you?
Very well.
Good. Your name, please?
My name is Herbert Moyo.
Herbert, there have been concerns about other people having contracted COVID-19 in the area. The congestions that we've seen yesterday, you've been on the queue for 4 days. Are you not worried?
I'm really concerned. I think from the Zimbabwean side, there is no social distancing where there are cars all over. Then coming to the South African side, also the COVID testing center again, because of the rain, people were crowding inside the tent. So there are chances of getting the disease from here, exactly. So I'm concerned, actually.
You're concerned, definitely. And that is, Michelle, a rolling coverage that we're prepared to be giving you throughout the day as we wait to see how people are going to be coming through here. Michelle?
Yeah, thanks very much for that, Pelane. And of course, it's a major concern there, and there is talk already that those gatherings at the Beitbridge border post is becoming a super spreader event. 50 confirmed cases there already. Now, Home Affairs Minister Dr. Pelane Pakgadi has also warned of a growing humanitarian crisis at the border. Tens of thousands of Zimbabweans are stuck there. Trying to get back to South Africa. That's after Zimbabwe closed its borders on Tuesday as part of its COVID-19 lockdown measures. For more on this story now, we're joined by the Limpopo manager for the Human Rights Commission in Polokwane. That's Victor Mabidula. Victor, good morning. Thanks very much for joining us here on the AM Report. I'm not sure if you heard my colleague Pelane Pakgadi live to us there at the Beitbridge border post. Already 50 confirmed cases of COVID-19. I'm sure you've seen and you visited the border post. You've seen the long queues there, people standing for days. Tell us about, the scenes that you saw there.
Thank you very much to you and the listeners. Unfortunately, I could not hear your reporter there. But what I can say is that, yes, we do have a challenge at the border gate, Musina, Beitbridge. But our observation now is that I think there's lack of management and planning in that particular place. We have engaged with other staff members there who are working there full time, and they are saying that they make a lot of proposals to the management, but those proposals are being ignored. We must not also forget that we are talking about the border gate that has been there for many, many years. the situation that we are facing right now, it's not new even to the department, but it seems as if there is no planning or improvement of the service there. Year in and year out, you will remember that we have people who always stuck. Either during Christmas time, they will be traveling to the north, to Zimbabwe and other African countries, using that particular border gate. And those after that, you will also have crisis when people are returning back to South Africa. So we are concerned that it seems as if there is no. In fact, after this crisis, people sit back and do nothing, because even the infrastructure, the way in which the border is being structured, I think it's a concern. We need to do something. Government has to do something about that, because otherwise we will always have this crisis. This is not new. We all know that people will be traveling and we have COVID-19. But you allow people, if you go to the private sectors or government buildings, some of the government buildings right now, you will find that if you are standing on the queue waiting for service, you will find that they will make marks where you must stand waiting for service. But, you know, if there is a service that needs to be rendered, why that was not done there? We understand the number of people. Then the question is, how do we allow people to make such a crowd, knowing that there is COVID-19 that is killing our people? And now if we have these cases that have been confirmed, we are asking ourselves if our staff members or if government officials who are working there are still safe. So it's a challenge that needs to be addressed.
And it's a challenge that needs to be addressed by both governments, Victor. How do you reckon we can go about, dealing with the queues there, and if those queues need to happen in terms of people needing to have these COVID-19 tests, at least setting up some infrastructure so that people can wait in line safely?
Yes, what we have discovered during our investigation is that there is a constant communication between South African officials and Zimbabwean officials who are working in the border there. I think there is even a WhatsApp group where they communicate with each other. So if officials, you will understand that when you are coming to South Africa, you will have a control area. And that control area is where people, you will find that they were congested there. They were just standing next to each other, waiting to be screened and off and so forth. So if we can have a situation where that kind of communication between the two, between the officials from two countries can make sure that you don't just allow people to go into another country without checking the number of people who are still being serviced there. You will never have that kind of crowd, because it will mean that if Zimbabweans are sending at least 10 people, people by groups, grouping them into 10, a group of 10, maybe sending them through and all those things, it means that the number of people who will be in the side of South Africa will be reduced. But if they are just sending all people who are just coming to their side to South Africa, obviously South African process will be a bit slow, because you will find that they have to test them, they have to process them, they have to check their documentation. So I think the communication between the two governments and also the improvement in terms of the infrastructure, if we realize that that space is very small, because it's a very, you can even see the bridge itself. It's a very small bridge. Even the people are passing there, you can see that if you have more than 10,000 people just standing waiting for service, you are also exerting a lot of pressure to South African officials there, and they are also risking their lives. Yesterday when we were watching the TV, we have seen other people going to the service point without wearing their mask properly, and we just feel for the officials who are working in that particular place.
And of course, we're seeing children as well queuing along with their parents. Many people telling our reporter, who is at the Beitbridge border post, that they've run out of food, they've run out of money to buy food. In fact, once they're in South Africa, they've run out of money to travel to the places they need to go to in South Africa. Victor, what is the way forward here?
What we are going to do, as you have indicated, we were of the view that maybe this problem will be attended to urgently. But what we have seen is that it's like there is a sense of denial that we are not. There's lack of planning there. The moment you deny, you say there's no problem. It means that you are not going to think further than what you have, or to do anything that what you have done. So we must understand, if you fail to prepare, you must be prepared to fail. Let us acknowledge that there is a problem and we fail to plan properly. And we go back to the drawing board and come up with a plan on how we will address this issue, because COVID-19 is going to be there and we don't know when this will be resolved, when it will disappear. So how best can we process people? Because if you have children and adult people not wearing the mask, they are all risking their lives. There are people who are coming from Zimbabwe. I'm just giving this an example. If you are coming from Zimbabwe and you want to get into South Africa, and they are saying that you must be quarantined, yes, you can pay all those people can pay for their testing. But the question is, do you have a place in South Africa where you can quarantine that number of people safely? To say that, okay, fine, you are inside our borders now. We want to make sure that you spend 14 days or 18 days, whatever period, waiting for you to check if you don't have further symptoms of COVID-19. Do we have a place where we can keep those people safely, to say that they are being quarantined in our country? No, we don't have such a facility where we can keep those people. So it's like we are saying something that cannot be practically implemented. So let us make sure that we prepare ourselves and we make sure that we put measures in place to make sure that we don't have such crowds anymore in our country. Because once people are in our country without food, without anything, we will, as the Human Rights Commission, if it need be, we will have to push the government to say, provide them with food. Because we have delayed them, you keep them in our borders. We can't wait for people to die. Yeah. If they die in our country, it means that we are responsible, because we have kept them for a very, very long time. 3 days is too much when you are in that place where it's hot like that. So we will engage with the department, with the relevant department, and I've also engaged with the CEO regarding this matter as to how best we can advise the government as to what they should do or what proposals can we have. But we are going to make proposals to the government as to how this problem should be resolved.
Yeah, and in the meantime, those people continue to queue there in tens of thousands at the Beitbridge border. Victor, thanks very much for your time this morning. Victor Mabidula is the Provincial Manager for the Human Rights Commission in Limpopo. A devastating story that we continue to track it for you right here on the channel. Now,